ovulation for those who don't know, and for those who want to have a better understanding of how they can track it, so that they understand when they're ovulating, because not everyone has that perfect 28 to 30-day cycle. How do you know when your ovulation window is happening?
Yeah. So I do the same thing for all my patients, and I'll do it for you today. I have this for my last patient that I just saw. So I like to draw it out. Okay. So
send us a picture after and we'll post it.
I will. So to understand anything we do in our field, you have to understand how a regular cycle works, like in a textbook. And when I say cycle, I mean period to period. Okay. So you start out a period with, and the cycle is divided into two halves. There's a first half, which is when an egg is growing, and there's a second half, which is after ovulation. So you start off a period with all these little resting eggs, and they're housed in little sacs of fluid called follicles that you can see on an ultrasound. And your brain makes this hormone called FSH, follicle stimulating hormone, that does what it says it does. It stimulates one of these follicles to grow. As it grows, it matures. As it matures, it makes estrogen. And then that estrogen feeds back on the brain and tells the brain, okay, I have my egg growing for the month. Stop giving me FSH. The rest of these then die off, right? So it happens every month. And now this egg is saying, I'm mature. Give me another hormone called LH that's going to surge in the middle of the month and lead to egg maturation. And 24 to 40 hours later, ovulation. Now your egg can meet a sperm. Now your body makes another hormone called progesterone that prepares the lining in the second half of the cycle to now implant the embryo. So when you're tracking ovulation, it first depends on how far apart your cycles are. If your cycles are 30 days apart, the key thing to understand is that this second half of the cycle is usually fixed. It's usually about 14 days. It's this part of the cycle that varies, right? So if you have a 28-day cycle, theoretically it should be 14 days for this half, so you should be ovulating somewhere in the middle there, and 14 days for the second half. If you have 30-day cycles, you're ovulating a little bit later. So maybe you're ovulating on day 15, 16, 17. So your window of when you're fertile kind of gets delayed. And so that's kind of the idea of ovulation. So if you have a 30-day cycle, you can pretty much say, okay, I know I'm ovulating somewhere between days, 12 and 15 or whatever it is. If you wanted to be really safe, your first day of your period, you count that as day 1, full flow before midnight, day 1. You count to day 10, or, depending on if you observe the mikvah or not, like the first time that you can. And let's say it's day 12, you have intercourse every other day from day 12 to 16 or whatever it is. And that's the best way to monitor it. Now, for people who have irregular cycles, it becomes a little more difficult. So usually you would use what are called LH kits, which basically you're testing the urine to see when this LH surge is.